Hey there, just going to record a quick update today. I'm on the road between Amarillo, going to drive through Fort Worth, Dallas-Fort Worth area, and on my way to Houston today. So, the thing that I wanted to talk about today is hydroxychloroquine. I think hydroxychloroquine has become somewhat politicized just because of President Trump's touting of it as a wonder drug and proclaiming that he was taking it. And we've had some studies come out both ways on it. But yesterday a study was released from the Henry Ford Hospital system, which is a pretty major system, large hospital system in the Midwest US. And they studied around 2,500 patients, COVID-19 patients. It appears from the study that most of them started receiving the hydroxychloroquine within the first day or two of treatment. Now, didn't make clear whether that was hospitalization or just even at home. But since it's within a hospital system, I'm gonna guess that it's while hospitalized. And some who are looking at the study believe that the early treatment with hydroxychloroquine may be key to the results. And the results, bottom line, were that essentially it cut the mortality rate for those who received hydroxychloroquine in half. Those who didn't receive the hydroxychloroquine, who were in the study, had a 26% mortality rate. And based on that, I'm thinking we're talking about all of these people being hospitalized, because that's closer to the hospitalization mortality rate. And the people who received hydroxychloroquine, only 13% died. So 26% versus 13%. So it did cut the mortality rate in half. So that's pretty interesting. And since it is a fairly large study, it's pretty meaningful. It wasn't a double-blind controlled study, so there weren't any placebos involved, from my understanding. It was essentially just looking at the patients who were on that treatment protocol and those who were not on that treatment protocol. So the double-blind study has yet to be done, from what I can tell. But meanwhile, it's pretty decent news, and it's a widely available drug. So, but it looks like it needs to be something that gets done from the onset. There's another interesting study, the results of which we do not know yet, that is attempting to show that you can take hydroxychloroquine prophylactically, which I believe is the theory under which President Trump is operating, essentially the same way you would take it to prevent contraction of malaria. I've done that before when traveling in countries where malaria is endemic, and it's not without its side effects, but if you don't take it for too long and you're a healthy individual, it typically doesn't have side effects. So that's the update for today. Thanks for watching. As always, wear a mask, wash your hands with soap and water. Try to convince your family members and friends that wearing a mask is the unselfish thing to do, and it would be really nice if the world was less selfish. Take it easy.